Today we're going to be treating a patient with extensive nasal veins using the ND-YAG 1064 laser with the M22 from Luminous. This procedure should take us about 15 to 20 minutes. This is our little test spot. See that? You okay, Gary?
Yeah, you can feel it though, can't you?
You can. Are you hanging in there?
Mm-hmm.
Okay. There you go. That's a decent setting. Can you tolerate it?
Mm-hmm.
You're responding great. The M22 laser by Luminous, the ND-YAG portion of it, is fantastic for treating facial veins, such as the nasal telangiectasia. It's also great for cleaning up any cherry angiomas or hemangiomas for patients. It's also great for any cleanup work post-sclerotherapy. If you have any residual matting from sclerotherapy injections, we can come in with this laser and clean up all of that residual matting. You can expect some slight erythema, which is pinkening or redness of the skin. You can also expect some slight edema or swelling around the vascular lesions that were treated. That swelling will dissipate and the pinkness will dissipate over the course of the day. When we are finished with the procedure, we apply a corticosteroid, a mild corticosteroid to the skin, and that's dependent upon whether or not the patient needs it. We also follow up with an SPF 30 or greater before we send the patient out the door. The medications we apply, or the sunblock we apply post-treatment, is left on for the remainder of the day. The SPF, you're going to need to maintain using that for the next 2 to 3 days, as you will be slightly photosensitive to the sun, so we want to avoid any and all unnecessary sun exposure. Don't plan any activities to the lake or a lot of outdoor activities like mowing or gardening. You want to protect your skin from the sun during the healing process. There is not a lot of visible healing process, but your tissue is holding on to a lot of the heat from the laser energy itself, so we want to avoid any additional exposure such as sunlight or overexertion of heat that can be accumulated from sitting in a sauna or spending time exercising aggressively the day of the procedure. By about 48 hours you can resume normal activities, but you definitely need to wear the SPF during and in between all subsequent sessions. Okay. For patients who have significant vessels or resistant vessels, additional treatments may be needed. You may find there are feeder vessels underneath the tissue which we can't quite see with the naked eye. Once we get in there and start treating you, if you do have a reoccurrence of vessels, it's best to come back and let us try to treat and shut down those little feeder veins in order to prevent the other little broken capillaries from refilling. Better? Ready? Some patients, you're going to immediately find the veins be, completely gone visually. There are times in patients where you will see the reoccurrence of the vessels. A lot of times those vessels, if they were very large to begin with, will come back just sort of lighter in appearance and not nearly as purple. Anytime you have that happen, that just means you need to come in for any subsequent treatment. It's very common to get good clearance in one session, but it's not always going to happen with every patient, as nobody is cookie cutter. Everybody has a different variable that we have to overcome. A lot of patients will be satisfied with sessions from 1 to 3. That's a very common range. That sparking is the condensation on the,
Oh, it is?
yep. It's just because it's chill tip, so when it gets water on it, it will kind of spark up a bit. It's not going to hurt you. It just makes a funny appearance for the camera.
So it don't catch fire?
No, yeah, you won't at all.
Special effects, yeah.
Yeah. Plus, some of it's your beard. I mean, the dense beard hairs will get. Did you
Right.
see that hair
Yeah.
turn? As we're finishing up here, we're going to treat a few of these extra little spots that we see are resistant or things that pop up. As we treat patients, typically what we didn't notice before now becomes prevalent. So we tend to go back and keep finding little things as we go along. And now we're treating a little cherry angioma. A lot of patients call them blood moles. Usually we can get these in 1, maybe 2 sessions. That's our clinical endpoint. We want to see that blood darken, and it just basically is coagulated blood, and it's going to draw down under the tissue and be absorbed by the body through natural means and flushed out. Thank you so very much for taking time to watch our video. If you are interested in this procedure or feel that you might be a candidate for it, please feel free to call our office and schedule a consultation. We would be happy to go over whether or not you're a candidate for this.